The following program is an original production of WYCC PBS Chicago.
Tonight, a national health crisis, the growing number of children afflicted with potentially deadly health problems because of their weight. What to do about childhood obesity.
Those new health exchanges open for business in Illinois and across the country, but many consumers are confused. And the national battle still raging over health care reform leads to a government shutdown that reaches Chicago.
And signs of Chicago's long reign as a town for foodies. Now these relics of restaurant history are nearly extinct. These stories and much more tonight on In the Loop.
Good evening, I'm Chris Bury.
And I'm Barbara Pinto. Tonight, a closer look at a growing public health crisis, childhood obesity.
According to the Centers for Disease Control and Prevention, nearly 1 in every 3 American children is overweight or obese.
Childhood obesity rates have quadrupled over the past 40 years, putting kids at risk for serious adult problems. Heart disease, stroke, asthma, even cancer.
Add to that the medical costs, nearly $14 billion a year. How did we get here?
And how do we turn the tide? Out of desperation, some young people are turning to surgery for help.
It's been a little bit over a month and I'm down 30 pounds.
21-year-old Aaliyah Holmes of northwest suburban Elk Grove Village is recovering at home from a life-changing operation, gastric bypass surgery.
And the main reason I did the surgery is so that I can potentially one day be a mom.
Before the procedure, Aaliyah weighed in at 325 pounds. Surgeons reduced her stomach to the size of a lemon, instead of the gallon of ice cream and chicken nuggets she used to consume. The typical meal now consists of a tiny piece of chicken, 1 egg, and a few small bites of cauliflower. Aaliyah knows this is going to be a long journey. She's been battling weight issues since kindergarten.
Mom was very good at preparing healthy food, but everyone at school had the cookies and brownies, and I just wanted them. So I would trade my healthy food for the bad food.
The bullying from other kids started in 4th grade. She shrugged it off for a while until she realized her weight was a real problem.
I went shopping with my best friend, and she put on a size 4 skirt, and at the age of 8th grade, I was already a size 18.
Aaliyah came home from those shopping trips and cried. To make herself feel better, she turned to her old friend, food.
I was overweight because I ate, and I ate because I was sad. It was a really bad cycle.
So what does Aaliyah think is to blame for today's high obesity rates? Easy access to junk food and fast food.
It's easy to get a hold of. It's always in your face. There's an advertisement every 5 minutes, and it's inexpensive.
It's not enough to say to people, have willpower.
Alyssa Bassler is CEO of the Illinois Public Health Institute, which works to combat obesity. She agrees that the prevalence of fast food plays a huge role in today's childhood obesity crisis.
If advertising and marketing didn't work, companies wouldn't be spending billions of dollars on it. It does work. We're all susceptible to that.
They're the first generation that might not live as long as their parents because of the health risks associated with being overweight.
That's why in 2010, the White House launched a campaign to battle childhood obesity, spearheaded by First Lady Michelle Obama. The program, called Let's Move, encourages kids to get more physical activity and to eat healthier food. Is it working? It may be too early to say. Childhood obesity rates have fallen in 19 states, but not Illinois, which remains stagnant, and 3 states experienced an increase in the number of obese kids. Aaliyah admits she spent too much time sitting in front of her laptop and not enough time being active. She's walking now and can't wait for her surgeon's permission to go to the gym and really work out. Her advice to worried parents: don't give in.
Just because they're whining and you want them to stop, don't just give them food. Distract them with something else and just make sure they stay active.
Now joining us today, Dr. Helen Binns, a professor of pediatrics at Northwestern University, and she also directs the Wellness and Weight Management Clinic at the Ann and Robert H. Lurie Children's Hospital of Chicago. Dr. Binns, welcome.
Thank you for having me.
We've heard the young lady in this story talk about the prevalence of fast food and a sedentary lifestyle. Are those the main culprits? Why are more and more children becoming so fat?
There are so many factors that influence weight gain in our children today, and those are two of the factors, but the other factors that are into play are advertising, what families have at home, the number of televisions and laptops and screen time for children, the in utero environment of the fetus even influences long-term risk for rapid weight gain. So there are many factors we need to address.
Wow, so it may start before birth. I saw a study out this week that said the weight of the mother during pregnancy may impact the weight of the child in its lifetime.
Yes, the weight concern is really throughout fetal life, infancy, preschool, grade school, throughout the lifespan. You have to be concerned with how to develop a healthy lifestyle.
You talk about infancy. I mean, this can be confusing to parents. How do you tell the difference between baby weight and something more dangerous? The way you look at weight is in relationship to height. And there is a system by where we can look at weight in relationship to height, and we have curves that are normed for even infants going through the first 2 years of life. About 2 years ago, the CDC promoted the use of the World Health Organization infant growth BMI curves. So we actually have BMI curves for infants that we can use to identify overweight in infants. Well, let's talk about Chicago. I know that the CDC had said that the obesity rate here among children is twice the national average, and for adolescents and teens, nearly 3 times. What are we doing wrong in Chicago, or what factors play into that?
There are many risk factors for obesity, and as we said, you know, the prenatal environment. So if the adults in Chicago are obese, well, the children are more at risk for being obese. We also know that some factors such as early infant weight gain is particularly dangerous in the Hispanic population. And so possibly some of our childhood obesity rates are because we have a fairly high Hispanic population.
People have talked about long winters keeping kids indoors, high crime that may keep kids indoors. Are those factors as well?
They are definite factors that we're asking in clinic. You know, do you have a way in which to be active in your house? And one of our questions we ask in clinic, do you live in a safe neighborhood? Is it safe to play outside? Because outside play is one of the big ways in which children can be active.
How likely is an obese child to become an obese adult?
There are a number of studies on that, and the new paper from the American Heart Association on severe obesity in adolescents noted that 100% of severely obese 12-year-olds will be an obese adult.
Wow.
And when you go even younger, they were reporting on children who were obese at age 6 had an 80% chance of being an obese young adult. So we have to reach very low in young children to really focus on the prevention of this problem.
Talk about the price these kids are paying with their health and the price society will pay for an overweight generation.
The children themselves are having more sort of cardiovascular related risk factors. Obese children are at higher risk for having high blood pressure already. We have a number of children who are being treated for high blood pressure. As young as grade school age, having high blood pressure. The most common orthopedic problem we see are flat feet and malpositioning of the knees and legs, and those children then have pain with activity, so it's hard for them to be active. The teens can progress to having insulin resistance, which is sort of a precursor for type 2 diabetes. So they may get type 2 diabetes earlier. And many of the children we see already have fat deposition in their liver, which puts them at long-term risk for liver failure.
Now, these are problems you'd customarily see in a population much older.
The thought is that they should be seen in a population that's older, but when we look in the children we're treating and we're working with those families at our clinic, the prevalence is sort of eye-opening, and we're really working with the parents and families to help understand the metabolic consequences for their child to motivate them toward family-based change.
Now, that's my next question. What do we do to turn the tide here?
As what we're doing in clinic is, it's not a child problem, it's a family problem, a society problem, and there are many things that Chicago is actually doing on the community-wide basis to make change by promoting parks and activities. And I have children coming in now saying they're eating a salad at lunch at school. It is so good. So we're making changes in the school system, in the food service, and we're working with families so those changes also translate into changes in the home. Have you changed so that you're buying healthy foods? You're eating healthy foods yourself and really modeling it for your children. You're talking about how good those fruits and vegetables are, so your children eat them, and you're preparing them for your children.
Right. Thank you so much, Dr. Binns. We'll have to leave it there. We appreciate your time. Thank you.
You're welcome.
Time now for other stories trending this week. The federal government shutdown and confusion surrounding the rollout of the healthcare exchanges. Here's Chris with more.
And thanks, Barbara. Also on the agenda, a gang summit fizzles and a new crackdown on cell phones in cars. The new government healthcare exchange opens in Illinois and across the country, but it's clearly a work in progress.
The Supreme Court said it's okay. Now let's go forward and work on it. And thank goodness people are having a chance at least to get affordable coverage.
Some Republicans still want to kill it, but the president insists the new insurance can save consumers thousands of dollars.
It turns out that their rates are up to 50% lower than what was available previously if you just went on the open market and you tried to get health insurance.
And that battle over health reform has the federal government grinding to a halt.
Mr. Speaker, it is now midnight, and the great government of the United States is now closed,
leaving hundreds of thousands of federal employees nationwide and many in Illinois out of work.
I think it's a fiasco, and that it's ridiculous that a small group of congressmen are holding the entire government and the country hostage.
As the U.S. Attorney smacks a violent Chicago gang with racketeering charges, a summit is called to calm the city's streets.
The main message today for this summit this year is that, look, the violence needs to stop, number one, and everybody needs to unify because families are losing. There's too many victims of violence out here in Chicago.
Texters beware. The Illinois State Police are cracking down on drivers who text behind the wheel. Put the phone down or pay up.
It should issue out $500 tickets, because there's a lot of deaths this year due to people talking and texting on the phone.
And to talk about all this, Chicago Tribune reporter Peter Frost, Linnell Harris, business executive and radio host, and Jane McCahill, senior partner for Paul Sonelli Law Offices. Hello and welcome, everybody. So the health exchanges opened this week with a little bit of a thud, long lines, computer glitches, some general confusion. Peter, not ready for prime time?
It doesn't look like it. So the first 2 days of the health insurance exchanges being open, at least the ones operated by the federal government, consumers have run into long delays, glitches with the system, and very few, so far as we can tell, have been able to log on and actually compare coverage.
Does this seem like natural growing pains, or is this a sign of something worse to come?
I would say it's natural growing pains. I mean, ultimately, whenever you go through a change like this, you're going to have some glitches in the system. It's the first 2-3 days. And so if we still have these same problems in November, then I would say, okay, there's a pause that needs to take place. But ultimately, I would say growing pains.
But Jane, the government's had a year to get ready for this.
You know, I think one of the things it tells us is that there are lots of people out there who are anxious to have health insurance coverage. Certainly it should have been anticipated that there'd be great demand on that system, but I think we've got several months for people to work their way through it. There are some systems out there with navigators who will help people through the system, so I think with time it will even out.
Peter, you cover this beat for the Chicago Tribune. Is this really a new era in health insurance?
Well, it appears as if it's going to be. I mean, the whole goal here, of course, is to get more people with health insurance in the United States. It's a huge problem, but even after this law goes into effect, there's still going to be millions of Americans or millions of people who live in America who are going to still not have health insurance. So this is a first step. Unclear sort of what the final solution is, or what the final situation is going to be.
Linnell, some companies are already really moving their people off of company health insurance here in Illinois. Walgreens, we have others as well. Are companies basically taking advantage of this system? Are they trying to get people off their own rolls here?
Well, I mean, I think it's tough to say that they're trying to take advantage of the system. I think it depends on the company, right? Some companies are very much employee focused, and they want to make sure they're doing the best thing for their employees, and so that could be the case. Others, they're looking to save money. So I think we have to take it company by company before we just kind of paint with a broad brush.
I think generally everyone's trying to save money here. Is what's happening. However, the one thing to note is that most companies are going to continue. Most large companies at least, will continue to provide health insurance to their employees because it's a very important competitive thing to retain and lure in new talent. So I don't think you're going to see a lot of companies drop insurance altogether. You are seeing Walgreens move into a new structure of providing that insurance, but I think most Americans who have jobs will be in pretty good shape with their employer.
And Jane, what about for individuals? I mean, are they going to see some real competition that may lower prices?
You know, I think as the stories have come out in the last day that the premium costs are coming down. I think that'll also be a matter of time. Insurance really depends upon lots of people participating, and the bigger risk pool we have, the greater ability there is to spread that risk. I think it does depend upon having both healthy people in, having young people in, as well as people who have more acute medical needs. I think that we do have a system where historically employers have provided that coverage, and I think, yes, we'll see that change with time. We'll see it change for retirees. We'll see an expansion of people who are at an economically distressed level getting into insurance when they haven't historically, and that should make a difference.
Of course, this whole issue has led to this government shutdown because Republicans and Democrats can't agree in Congress. We're seeing parts of the government grind to a halt. And Linnell, justified?
Yeah, I say no. I mean, so we elect these officials to lead the country. And whenever they're letting what seems to me to be very personal and egotistical matters get in the way, then we have a severe problem. Because, I mean, here it is, we're already in a deficit, we have a severe economic crisis on our hands, and then we shut down national parks that bring in revenue. I mean, that just makes no sense to me. It really doesn't. And so it's, I don't think that there's an excuse. And ultimately, I know they're working hard at it, but they need to be doing more work around how do we get things moving again.
I say no too.
Yeah.
There's no reason for it. And I think that to turn it on, hey, we have to undo the Affordable Care Act that we passed 4 years ago, that we challenged to the Supreme Court, that we tried to pass legislation to undo, to say let's use the budget or a continuing resolution, it's not even a budget, let's use that to try to get our way. It isn't in the interests of people or government or good policy.
I think it's very personal. I think it's become very personal. And here it is, you have a party that's divided among themselves about the issue. I mean, and so it's disheartening, and ultimately I'm hoping that they can come to some type of conclusion that does not include messing with the Affordable Care Act.
Well, Peter, Republicans, especially the Tea Party members and even the Speaker of the House, John Boehner, are casting this as a matter of fairness. Their argument is that, look, the government's already giving delays to some businesses, why not individuals too? And that's the argument for letting this reach the stage it's reached.
Well, it appears as if it is. The one thing to keep in mind, though, that now the sign-up period has begun. Good luck trying to roll that back now. I know the President and the Senate Democrats have made it very clear that they are not going to budge on the Affordable Care Act. It's going to be, like I said, really difficult to roll that back after people have already started signing up. So I think that argument is sort of dead on arrival at this point. Now it looks like they're focusing on the debt ceiling on October 17th, when we run out of money, apparently, run out of our ability to borrow at least. So I think a lot of the wrangling is going to be around that number instead. And I think Republicans have sort of started making indications that the Affordable Care Act is kind of here. So let's move on to the next argument.
What about the consequences of the shutdown? I mean, here in the Chicago area, we're already seeing the Indiana Dunes National Seashore Park or Lakeshore Park shut down. The Lincoln Home is shut down. We have thousands of federal workers on furlough. As this drags on, what do you see as the political effect, as people start feeling the effects of this?
I think that's come through in what some people have said, that frustration with it. And to have that many people who are not going to work has implications really throughout our community, without even getting to, well, what about the programs that people don't even know government is behind? And there's been talk about environmental protection, there's been talk about women, infant, and children's program, that those are going to be affected.
Yeah, and there was a recent report just put out by Goldman Sachs that says we are losing GDP, we are losing money, the taxpayers are on the hook for more money the longer this thing sticks around, the longer the shutdown sticks around. I think they said it was 0.2 percentage points is what we're going to lose in the first week, I think.
So who's the pressure on here, politically thinking? Well,
hey, I would say the Republican Party, ultimately. And I know there's a lot of push on, Barack and the Barack Obama and the Democratic Party to, concede in some way. But here is a party that's completely divided in a lot of ways. And I was reading Wall Street Journal yesterday, and their approval ratings, I mean, people are saying, I believe the government shutdown is their fault. And I mean, you can look at the election, 2012 election. They already have a demographic issue, and if they don't start to get their act together and really understand what the American people want, I think it's gonna be a dim outlook for them.
We have to move to the city desk now, and here in Chicago, the U.S. Attorney announced a crackdown on a violent street gang called the Hobos. Is that kind of thing public relations, or is it going to make a significant impact, Jane?
It doesn't seem as if it's making much of an impact. I think that when we talk about violence, it's one of the fundamental health issues that I think this city faces, and there's not an easy answer.
At the same time, there was this gang summit. Reverend Meeks here in Chicago, he held a summit, and basically nobody came.
Yeah, this is what I would say. How do you get gang members to come to a summit when just a few months ago we were talking about locking any gang member up? Like, I mean, if you're a gang member, you're on the street, we're going to lock you up. And so in the world of social media, digital connectivity, why would I come to a summit where, I mean, just recently I was under threat? I mean, it could be a setup. I think we have to do more work from a PR perspective, and you said that, of really letting these individuals know, like, hey, we really want to come to some type of, bring a forum together, come to some type of conclusion around this violence in the city. But you can't just throw a summit together, expect people to show up. I didn't even know about the summit, and I'm a radio host. I think that's interesting.
Peter, is this one of these things that's just being talked to death?
Well, it is, and I think for good reason. I mean, anytime you see, a couple of weeks ago we had that shooting in that Southside Park where 13 people were shot, including a 3-year-old. Of course people are going to be talking about this, and that's the kind of thing that puts Chicago in the national media in a very ugly light. And long term, this is going to have an effect on the tourism industry for this city, on this city's reputation for business. It's something that needs to be talked about, but more than that, there needs to be some sort of action, and I'm not sure what that is.
Yeah, and this is what I would say. I don't think that this is all just a gang problem, right? There is economic recovery that needs to take place in these neighborhoods that is being overlooked. And so to say, oh, we're going to have a gang summit, I know it's a good thing. I don't want to minimize it, right? It's a really good thing that Reverend Meeks and I believe the minister from California were trying to do. But ultimately, it's going to take, I think, many more resources and more organizing around it to get underneath it.
Hold on that thought because we have run out of time. So Peter Frost, Linnell Harris, Jane McCahill, we thank you very much for your time tonight. And now, a sign of the times, older times, many of Chicago's classic dining spots have faded into history, but in some cases their original signs remain, as you'll see in our trip tonight down memory lane.
We're here in the heart of the Loop, just a couple blocks from the Art Institute on Adams. Behind me is the Berghoff, one of the great established old restaurants in Chicago. Dates to 1898, moved to this location in the middle of the 20th century. What's interesting, in addition to it being a great German restaurant, an institution that everyone who visits Chicago knows about, is it's also in some of the oldest buildings in the Loop. There was a fire in the Loop in 1871, burned everything down. These buildings were built in 1872, the year after the fire. So one of the oldest restaurants in Chicago is in one of the oldest buildings in Chicago. Its sign is also interesting. It's a blade sign, a vertical blade sign, the kind of sign you'd usually see in a movie theater. And this is what restaurants in the Loop used to have. They'd have these giant signs to track people as they're walking down the streets. This is one of the last ones left of a Chicago restaurant because the restaurant has survived all this time. We're here in the South Loop on Jefferson, just north of Roosevelt Road. We're in front of Manny's, one of the great Chicago delicatessens. Been around since 1942 in the neighborhood, been at this location since 1964. Well renowned for its corned beef, its pastrami, and its visit by President Barack Obama, and every politician who runs for office in Chicago pays a visit to Manny's. The sign behind me dates to 1964 when they moved here. I love this sign. It's got rectangles, it's got an arrow, it's got a circle, it's got a pylon. It's a classic 1960s sign, exuberant, arrow pointing the way to come into Manny's and have a pastrami and corned beef. Great restaurant, great sign, a great institution for Chicago. We're here in front of Lou Mitchell's, one of the oldest restaurants in the downtown. We're in the West Loop, about a block from Union Station and Sears Tower on historic Route 66. Lou Mitchell's has been around 90 years. They've moved to this location in about 1949, and that's when the sign dates from. And what we're looking at is a neon sign, a channel sign, where you have script lettering inside stainless steel channels. And it's been around for 60 years. It's amazing. It survives. It's been well cared for. It's one of the classic signs in downtown Chicago. Among the other signs left in Chicago that are tied to eating institutions, you've got Margie's Candy on Western, you've got the Palace Grill, you've got the Italian Village. These are institutions that have survived, and so their signs, which were built in the early days, also survive. But it's a small handful. We're talking less than a dozen citywide.
And that does it for us tonight. You are now in the Loop.
Visit us at WYCC.org to hear our panelists weigh in on the texting and driving crackdown. Until next week, I'm Barbara Pinto.
And I'm Chris Bury. Good night.